Hello everyone, welcome to the CX Care Pro Show. Hello Emmanuel.
Hi, Laura.
Thank you for joining us today. What topic are we going to explore?
We're going to talk about the rules of the game in the field of healthcare because they are changing.
And so what's the interest of Extens Consulting to address this topic?
Until recently, the clinical aspects of hospital care received most attention. Now the entire patient experience has been shown to impact quality of care. And patient satisfaction is a key priority for physicians and hospitals.
And to talk about it, let's meet Diane Hopkins from Philadelphia. Why has patient experience become a high priority in the U.S. healthcare industry?
About 20 years ago is when the industry started to take patient satisfaction a little more seriously. Many things have happened since then that has made this mandatory for hospitals to address. A few of the things that happened, first is the internet. And patients and consumers have become empowered. They can search on Google or anywhere else about their symptoms or about their ailments. And in the early days of computer searching and internet searching, physicians weren't prepared for this. Physicians weren't prepared for patients to walk into their office with a pile of paper that they printed off to say, here's what I'm experiencing, is this what I have? And the physician didn't have an extra 25 minutes to sit with you to see, number one, is what you brought in legitimate or not, and does it even apply? So that was the first thing. The empowered consumer changed the game. The next thing is in the United States, the government decided to start incentivizing hospitals for meeting certain patient satisfaction standards. Instead of paying for just procedures or work that they did, they were going to pay for value. What did the patient achieve as a result of the work? So value-based care changed the game. So now if you don't hit a certain patient satisfaction threshold, you will not, from government payers, you will not get the full reimbursement. Well, that became a financial driver. So now you've got empowered consumers, you've got a financial guidance, then came social media. Now patients can talk about their experience with a doctor or with a hospital, and they can say something good or something bad in 10 seconds to 10,000 people. And so the reputation of the hospital now was very important in details. Prior to that, what people felt about their care was pretty much a secret, based except for your family and your friends. So now you can broadcast across the world. So when you have the financial incentives, you have empowered consumers, and you have social media where people can share information so broadly, the game changed.
As patient experience reporting became more transparent, how did medical staff adjust?
Hospitals had to adapt, and some did it quicker than others. Some physicians were not happy about this. When this became a key priority for hospitals, things had to change in who you hire, how you hire. Physicians also had to be compensated now differently on patient satisfaction, which made some of them unhappy at the beginning. I actually had a physician tell me years ago that patients are not qualified to rate me. And they certainly may not be qualified in the knowledge he had about his specialty, but they certainly are qualified to know how he treated them. And that was a big adjustment for some of the physicians at the beginning of all this.
What are some of the initial steps a hospital needs to take to strengthen their consumer experience culture?
There are many issues that hospitals have to weigh as they want to become more patient-centric, and that begins with leader alignment. The senior leaders of the organization can't all have different perspectives about what patient experience is or isn't. It has to be something they're aligned with, and they have to show the other 11,000 employees that there's one leader's voice around patient experience, how it's integrated with quality, integrated with safety, with finance and operations. So once your senior leader team realize that patient experience is not off to the side, it's integrated with all the other operations, that's the first big step. The next thing they have to realize is that all 11,000 employees in the organization have influence. They all see things we don't see in the boardroom. They know things we don't know because they see the patients at the bedside, when they park their car, when they're checking in. And so being able to activate all the insights our own employees have that we don't regularly have a chance to capture and use. That's where I spend a lot of my time, helping organizations figure out how to meaningfully gather what our own employees are seeing every day. And we do that through co-creation. And co-creation is not that we do a quick survey once a year with our staff. I'm talking about meaningful, regular, ongoing workshops, co-creation sessions where the frontline staff feel comfortable, feel valued, and we benefit and the patients benefit from their insights.
How do you define patient experience after your years of studying the topic?
In hospitals and physician offices, patient experience is defined by many different people, many different ways. And that's part of our problem of not being aligned. And what I try to get leaders and frontline staff to understand is patient experience is everything and anything. It's dependent upon this patient, their family, their diagnosis. And people will say, well, how can I be prepared for everything and anything? How do we prepare for that? Well, we build an instinct. We build courage to try things, and we build competencies and tools that help people be able to react to something that happens often or something that happens very rarely with kindness, with empathy, and knowing that their organization is supporting them as they try to create an exceptional experience.